Hey everybody, this week I am delighted to be joined by Dr. Sinead Vaughan-Jones, an award-winning scientist with a Master of Science in Chemistry, PhD in Biophysics, Forbes 30 Under 30 in 2024, and won the 2023 Potts Medal for her outstanding contribution to science. Now the founder of Booby Biome, a biotech company leveraging their knowledge of the breast milk microbiome to revolutionize infant health. Sinead, welcome to the Health Tech Podcast. How are you doing?
I'm good, thank you. Thank you for having me. Can't wait
You're
to
very
chat
welcome.
all things breast milk.
Yeah, there's a lot. There's a lot topical. There's a lot interesting. There's a lot that needs to be talked about that hasn't for many, many years. So, yeah, really excited to get into this. But yeah, before we get started, whereabouts are you speaking to us from today? Where are you based?
I am actually in my London flat, so in Little Venice, near Warwick Avenue.
Oh, beautiful around there.
I mean, it sounds a lot nicer. It is quite a small flat.
It is quite nice. There's that cafe over the river, isn't there? I used to live in Queen's Park, so I was quite near to it. The brown and the orange lines are sort of around there, aren't they?
Nice.
It
is a great place to have a morning coffee.
It is. Although I imagine you don't get there enough being a founder. But anyway, I'm sure we'll get into it. Listen, Sinead, honestly, absolute pleasure. You've been on the Health Tech Pigeon podcast. We've broken down the health tech news, so listeners don't have to. We've done that one. But yeah, looking forward to get into this because we can go deep into the story. There's so much that I want to talk to you about with obviously everything that you've done. Like that background that I've just read out is it's crazy everything that you've achieved already. That's such a young age. But yeah, your research that you've been doing into this, transferring that research and commercializing it into a startup, breast milk microbiome, these are all brand new terms. So yeah, looking forward to educating myself and the audience here. So I guess for the benefit of me and our listeners, why don't you give us the long version? Why don't you tell us your story?
So I'm going to take you back all the way back to how I grew up in a tiny village in North Wales, right up in sort of the mountains in Snowdonia, where everyone spoke Welsh. So I attended a Welsh taught school, I did all of my studies in Welsh, and I couldn't really confidently speak English until I was around 16. I mean, some days I feel like I still can't really confidently speak English. But really during those years, music was my thing. So I started playing the piano when I was really young. And that was partly inspired by my dad, who was an amazing piano player. And by the age of 10, I could literally play this Mozart piece with my eyes closed. And the reason I say that is because I was never one of those child prodigies that had perfect pitch or could play the piano from ear. I was a child who would practice something over and over and over until I got it to be perfect. And I actually think that's a really important part of my story, because a career in science or in business was never on my radar. Back then in North Wales, there was this huge lack of representation in science and also for women in entrepreneurial roles. So in my school, there was not the option to do A-level in biology, and also not really the option to look up to these women in science that got you really excited about it. For all I knew, science was something that you'd do if you wanted to go into nursing or wanted to go and do medicine. So during my A-levels, I just randomly selected chemistry, and really only because the subjects were put in columns and there was nothing that I liked in that column. And it still baffles me to this day how you're expected to make these decisions at A-level or when you go to university, and they can actually influence your career path for the rest of your life. And so I chose chemistry by complete chance, and first week in, I was so behind. Everyone else had done the triple science or done the higher tier modules in GCSE, and I really hadn't. And I remember absolutely hating that feeling of being behind. And I had this sort of burning desire to show everyone that I could actually do this. And that's actually been a bit of a common thread throughout my whole career. And so what I did was every single class, I would revise over and over. I would practice the calculations, repeat the equations exactly like I'd done with the piano. until I got really, really good at it. And I got so good at it that I ended up studying chemistry for 4 years at university. And there I was really doing what I knew I could do best, which is learning material in really high detail, retaining that information, applying it to exams, and getting a really high score. Now, did I enjoy drawing chemical structures on a piece of paper or trying to solve quantum mechanics equations? I don't think I did. But I loved that challenge and I really loved learning. And then it came to the first research project that I did at university. And what that research project was developing a drug into nanoparticles to treat malaria. And what was so cool about this project is those nanoparticles were synthesized in that lab. There was a patent for the process that had been developed, and they were talking about conducting clinical trials. And that was really the first time that I really sort of clocked the benzene structures or the chemical structures that we draw on paper can be synthesized in a lab and used to treat people. And that's really when chemistry became so much more than just learning theory off by heart. And it was this idea of inventing things and patenting them and having real world applications that really excited me. And that led me to do a PhD at UCL and King's College on a program called the London Interdisciplinary Doctoral Program, also known as LIDO, not to be confused with the swimming pools in London. And that's when I specialised in both chemistry, but also in cell biology and in biophysics. And it really didn't matter to me that I'd never done biology or physics before, because I knew that I had this ability to pick something up and learn it if I really set my mind to it. And I worked on this really cool project on DNA origami. So do you know when you fold pieces of paper into origami?
I do.
Well, you can do that with DNA to create these tiny nano-sized structures. And I actually invented the first ruler that could insert into live cells and could measure properties about the cells, whether it's different sort of disease states or different phenotypes. And I absolutely loved it. But then in the second year of my PhD, still sort of obsessed about inventions, I was really building out my CV to become a patent lawyer. And so I joined this program called Biotech Yes, sort of like a Dragon's Den. You make a hypothetical company up and you pitch it. And I did it with two colleagues who are now my co-founders. And I simply did it to, help out with the IP until I read about the breast milk microbiome. And I remember Lydia, my co-founder, telling me, did you know how in breast milk there's a community of bacteria like in our gut? And whether or not you have access to it can influence health for the rest of your life. And this was in 2018. And truthfully, I had no idea. It turned out that not many people knew about it either. And that's really kind of when it struck me how severely under-researched it was, how there was no funding, there was no innovation. And really, how could something so crucial to human health be so neglected? And what was even more troubling is that the world that we live in has created so many disparities when it comes to access to it and health outcomes. And so we became really passionate about this idea of making sure every baby has the access to the breast milk microbiome, but also that every parent has the opportunity to provide one. And that's when we thought, can we understand everything that lives in the breast milk microbiome to invent, to mimic what is happening in the breast milk microbiome? And in the second year of my PhD, Ruby Biome was born. But strangely, everything that led me to that point somewhat prepared me, because it didn't matter that I didn't have a PhD in microbiology, because I'd already proven to myself my ability to pick things up. It didn't matter that I had never written a business plan or made a financial forecast, because I knew I had it in me to teach myself. And it didn't matter that everyone thought we were absolutely mad for setting up a company in the second year of our PhDs, because I had this sort of burning desire to prove them wrong. But really what truly mattered was finding that driving force, that thing that makes me wake up every day with a purpose. And that was it. For so long, I'd just been doing something because I was just really good at it. And for the first time, I really felt that I had ignited a passion within me. And that's what led me to where I am today.
Wow. I love this. And it's so funny, isn't it, that I heard a phrase a while ago, and I've regurgitated it ever since, and I've forgotten who I heard this from now, but someone described having the benefit of adversity once when I was watching something, and it's a very strange concept, the benefit of adversity, and it's that, I guess, that notion that what you have to, I guess, glibly, what doesn't kill you makes you stronger, but like having to fight against something, having to fight against some sort of adversity is going to give you a strength in a domain that you can then deploy against, like, once you've got back to normality, you've equalized that adversity, you're then deploying that against, like, I guess, improving the world in some way, or yourself or your situation or whatever it is. And I think that's really interesting, because you talk, one of the first things you said was that there were no role models. There was nobody to look at in science or business as a woman to make you believe it was possible. So you had to sort of teach yourself it was possible. You're drawing on your musical background, the fact that you have to practice everything, this, hard work or consistent hard work beats talent. You're sort of proving that, as you say, to yourself. And I think that's just such a fascinating concept, that you almost had that benefit of adversity, that no one did believe in you. You didn't have the role models. You didn't have the born talent to just pick up the piano and be grade 8 in a year. Like, you didn't have that. You had to work hard. But then, as you say, you've just proved that actually doesn't matter now. I've now learnt this fundamental first principle fact that you do not need to have a baseline knowledge or a baseline amount of talent. I can just prove that I can do it myself. I can learn it. I can put the reps in. I can figure this out. I can conquer the intellectual challenge. I can conquer however much work it's going to take. It's just such a wonderful thing to have proved to you, because, like, I see the world often from, like, in freedoms, and it's a strange, I guess, framework that I see the world in. But, like, I can remember being like 18 years old, and all my friends were going on these holidays in the winter, and I was like, I can't ski, so I've now not got a freedom I want, so I'd go and learn it. I couldn't ride a bike until I was like ludicrously up, but like had to go and learn it, because then it's give me this extra freedom. But like that simple.
It's funny that you say that, because I was the same. I never
really
either, and at 26 I decided that I would learn how to ski. But what I would say really quickly there is that I completely recognize that I have privilege that other people don't have.
Of course.
Right? So, my parents could pay for my piano lessons, or could pay for me to, all sorts of different things. And I think it's important for us to recognize just how important that is. But also, what I think really pushed me was this drive that I had, this determination of not giving up. And I think,
I love that.
Recognize that privilege.
It is. And I think one thing about role models is that some people can often arrive at being a role model without wanting to be there. I assume that you might even fall into that category. A woman in STEM, like, doing so much. There are going to be people in your DMs all the time asking you how you did it and all that sort of stuff, because you aren't in large supply. Like, you're in a group that is not in large supply. Now, some people don't want to be role models. They don't ask to be role models. And some people are sort of thrust into the limelight. But I guess I'm just interested, like, where do you sit on there? Like, if you can talk to, I guess, the concept of being approached by lots of people now and being in that position, Forbes under 30, winning science prizes, like all that sort of stuff. I imagine you are a role model for so many people. Like, does that sit comfortably with you?
I guess it does, because I know that I have it in me to want to help so many other younger women to reach their goals and to do what they want to do. And the reason I feel so passionate about that is because I had someone help me. So something I didn't really talk about in my story was how I have a mentor who has ended up being a non-executive director on my company. And some of the listeners might know who this person is. It's Dr. Helen O'Neill from Hertility. And it's a really funny story where I kind of mentioned in my story how I really wanted to be a patent attorney or a patent lawyer. And in the second year of my PhD, when I was doing this competition, I had an interview to go into one of the best IP firms in London. It would be the case of quitting my PhD and going straight into this dream job. And it was a final stage interview where I was told to do a presentation on CRISPR-Cas9. Did I know anything about CRISPR-Cas9?
Helen certainly does.
Was I going to learn everything about CRISPR-Cas9? Yes, I was. And so I was researching, who are the best people at UCL, which is where I was, doing CRISPR-Cas9. And it was around 3 a.m. and Dr. Helen O'Neill pops up on Google doing a TED talk on CRISPR. And I sent her an email at 3 a.m. saying, I've got this interview. It's my dream job. Please, can I come meet you? And she replied. I think she felt sorry that a poor PhD student was sending emails at 3 a.m. And I met her. She was helping me about all things CRISPR-Cas9. And we happened to talk about Booby Biome. And it was kind of this idea. I wasn't sure I was going to do it. I love the breast milk microbiome, but I wasn't sure. And she just said, I've never seen anyone so passionate about the breast milk microbiome and everything that you've just said. You need to do this. And really having a sort of external person who I found to be a role model saying that to me really pushed me to go for it. And I really haven't turned back. And she is now a non-executive director on the board. She's been such a huge help in warm introductions to investors, helping us with our direct-to-consumer marketing strategy, everything you can think of. And so it's really important for me to sort of do that to someone else.
Yeah, and it's a gift, isn't it? It's a gift recognizing that privilege and then being able to give it back is a gift. I that's what people often don't realize, if only I could answer everybody in the DMs, and help them. It's funny because the ones I have, I've just had so much value from it personally of there's the feel good factor, but then there's, I don't know, it just runs a bit deeper than that for me. It's sort of like you're shortcutting to the end almost of like, well, I could build a massive business and exit it and do all those things. What would I do then? And it's like, well, at that point I start giving back. Well, why not start now? It's really nice. And you're absolutely right. It definitely does take recognizing that privilege. The other thing that stuck out for me in your story is that it seems like innately you understand that, again, I don't want to sound too glib here, but like loving something can take work. You don't have to necessarily love the process even. You can just love how it makes you feel at the end. And that can help you love the thing. You talk about North Wales, right? I went canyoning in North Wales. Wow. and it was not summer. So even if it was summer, it's still going to be cold.
It was never summer in North Wales.
It's never summer in North Wales. Absolutely. It was for one of my friend's birthdays when I was an anaesthetist. He was also an anaesthetist, and there's a few of us that had we got a log cabin in the middle of nowhere and went canyoning. And I hated every single minute of this because I was freezing cold, and it was so physical, and you were like jumping off stuff, and I hate heights, into freezing cold water, which I also don't like. But at the end of it, I've never felt better than when I walked back into that log cabin and I was like, I want to do this again. I want to do this again, just because that feeling was amazing. But there's definitely something in your story about you don't have to love putting those reps in. You're just willing to do it because you figured it out now. You sort of know the formula for yourself and how you work. And that's sort of the punchline here, is that this is all so much to do with self-awareness, but you're willing to put yourself through those reps. You're willing to put yourself through the hard work, knowing that the love will come. The love might come. It might not, but it probably will. But you don't have to love every single minute, right? You're willing to put that work in for, I guess, what you're looking to do at the end. How much does that sort of relate to you, I guess, in the macro of your life? But I guess building a startup, right? This has got to be the same thing. The day to day is very difficult. So that might be a nice segue into Booby Biome.
Yeah, definitely. Resilience is a thing that most or all of us founders really have. And it seems sort of obvious how, you just don't give up. You really believe in the vision of what you're building. There's never been a day where I wake up and I question what we're doing at Baby Biome, because I really know what we're doing is going to have a profound impact on health of every baby, and by extension, the future of humanity. And so even these small setbacks, or doing something that I don't enjoy, not getting a term sheet from my dream VC, or having someone question our strategy, it really doesn't matter. It's recognizing that these are all part of the journey, and these are all things that we can learn from and adapt, and never really let these sort of temporary failures ruin what that long-term vision is. So that's been a really important part of.
I think that's the thing about the whole "do what you love" phrase. Like, irritates me a little bit, because like I think it gives people like a really unrealistic like thing to aim at. Like that's taken far too literally. You're not meant to literally every minute of every day love what you do. Like that's so unrealistic. And I think people can end up making quite bad decisions about career and all sorts, because they're not, as you say, leaning into that, like, I need to be resilient. This tough time is going to teach me resilience. That resilience I can deploy later against more tough times, and I can even potentially enjoy it later, but it sucks now. It needs to suck now. This is growth. And like, I think so many people get that wrong, but
I'm doing so many things that I hate, the fact that I'm talking on a podcast now, if you would have asked me to do that a year ago, I would say absolutely not. That's something that my co-founder Lydia does. And you always have to put yourself in uncomfortable situations for that long-term gain. You would have maybe got from my story that what I love is figuring things out, troubleshooting. So, you give me a spreadsheet where there's 10 bugs in it, really figuring out what those bugs are is what gets me going. I love it.
Yeah.
And so there's always going to be things that you don't like, but yeah, just have that long-term vision in mind.
Totally. Let's talk about the start of Baby Biome. Second year of your PhD, you're doing this research. It's an opportunity for us to talk about some science here, because I think that the wellness world is stealing the word microbiome from us scientists. And I don't like that, because everyone's throwing the microbiome word around and everyone's saying, oh, it's great for your microbiome. That is a meaningless phrase. That is a phrase that's absolutely nonsense. Like, how do you know? Like, you don't even know what's in the microbiome. You don't know how this really works. Microbiome. Like, we are so early in these microbiome days, but the B2C wellness world has the unregulated, I should say, B2C wellness world has jumped on the microbiome and is I think taking it from us. So I would like you to give me a science lesson here in, like, where were we with the microbiome in breast milk? Let's talk about breast milk, because it's what you understand, obviously. I imagine you understand it in much broader terms than that, but I imagine you know far more about it than most people. But yeah, let's talk about it. Like, where was that knowledge and research when you started like this work, and what did you learn in your research that then you're applying later? Let's talk about some science.
Let's do it. So, thing is, with microbiome, there is so much that we don't know, and I think you make a really good point there that it's being stolen by the wellness industry. We're seeing it being cropped up on shampoo bottles and everywhere, and it's quite frustrating. It's completely unregulated, whether we're talking about skin care products or whether we're talking about food products, and I think a lot needs to change. But before we get to that, I think our understanding of the microbiome is improving. We know all about our gut microbiome these days, which is the community of bacteria that live in the gut, and how it has a huge impact on so many different types of diseases. But the breast milk microbiome has not been known for so long. It was actually only discovered in the early 2000s.
Whoa.
Crazy.
Whoa.
And it was actually a little bit of a debate in the scientific community as well. So yeah, it was a debate. It was discovered in the early 2000s, and it was discovered because we've got techniques like 16S sequencing that allows us to detect what's living in that sample. And that was great, because it really sort of enhanced our understanding of what is living in the breast milk microbiome. But what it really failed to do was differentiate between bacterial strains of the same species. And
Okay.
why is that important, right? It's important because we've never had a comprehensive insight into the functional capabilities or the complete genome of those strains. And strains of the same species can have completely different metabolic capabilities. They can have completely different virulence factors, completely different antibiotic resistant genes. And so, whilst we sort of painted the picture of, oh, this species lives there, this species lives in there too, we didn't understand what they were doing. And what's also really important about the microbiome is it's completely unique to ourselves. And so many different factors can impact it. And we felt like the literature didn't have that comprehensive overview of what was just living in there. And no shock, there was no innovation because we didn't have the data in the first place. And so, what we started doing from 2019 was build the world's first shotgun metagenomic breast milk microbiome database. Bit of a mouthful. And
Catchy.
what that enabled us to do was really map out what lives in the breast milk microbiome to strain level resolution. So really expensive, but really worth the time. And when I talk about the microbiome, I'm not really limiting myself to bacteria here. I'm talking about viruses, fungi, you name it. And with each sample, we would pair the data with a sample of that mother's baby, and we'd conduct the exact same type of sequencing. And we did that so that we can understand which strains living in the breast milk microbiome was actually colonizing and having an impact on the infant gut.
Interesting. Okay.
And what was really unique about that database was how we asked every mother and every baby to complete an extensive questionnaire where we would ask about diet, ethnicity, geography, how many babies do you have, how long have you been breastfeeding for? And for the first time, we were actually able to identify factors that influence that microbiome and help us identify a core microbiome that every baby should be receiving in the first months of life. And so this database has been a really important asset of BabyBiome, and it's something that will forever be building, because the more women we have, data is power at the end of the day, the more we can use that to drive different product developments and even one day perhaps have a completely personalized approach to what the breast milk microbiome looks like and what products we can make for babies who are not breastfed.
Yeah.
And the reason we did that was because we wanted to create a supplement that was designed from the breast milk microbiome for babies who just didn't have access to it. And so the database was the first step, but really building a biobank was the second step. So really going into the breast milk and isolating all of these strains, hundreds and hundreds of strains, to build a biobank of proprietary strains that have been completely unique to the breast milk microbiome. And really what we've been doing for the last 5 years is building out that database, building out that biobank, studying every single strain one by one, which has been a really long process to identify which ones are crucial for that developing infant gut. And that's really the essence of the product that we're building. So the very first supplement for babies that has strains isolated from the breast milk microbiome and in a community to really mimic that ecosystem.
So I've got a lot of questions here. Now, this research is fascinating, not just because you're identifying what's in the breast milk microbiome, the fact that you're pairing it to then the baby's microbiome, and then you're understanding the factors that can then influence all of the above. Yes, this is obviously incredibly useful to then develop the supplement. There's a health equity piece there for babies that don't have access to breast milk for whatever reason. You're leveling the playing field massively. My initial question here is about what you learned, when you were looking at those things, what was surprising? Were there any particular factors that really stuck out as like really big factors for influencing, breast milk or baby gut microbiome? Yeah, how was it particularly varied between people? Like, was there much variance? Like, I don't know. Talk about what you sort of found in that constellation of research.
Yeah, that's a great question. And I should start with saying, yes, the results are super varied. So everyone's breast milk microbiome is completely different. And that's really interesting for us because we would identify some women whom we call super donors, and they would have really high abundance of beneficial bacteria like bifidobacterium, whilst some women would have really low abundance of species like bifidobacterium. And for us, it was really important to understand why that was. And that's really why doing that extensive questionnaire was important for us. And we've had so many different types of factors that we didn't even expect that could influence both the breast milk microbiome and the infant microbiome. Actually, one of the surprising ones was the impact of combi feeding. So combi feeding is when you breastfeed, but you also supplement with formula. And sometimes this is necessary due to things like low milk supply, pain, poor latching, especially as the baby grows. And what we saw was actually the impact of combi feeding could not just change the infant gut microbiome, but it could change the breast milk microbiome. And that's something that sort of blew our mind. We'd expect for that change to happen in the gut microbiome because, formula milk have different sugars that might promote the growth of different types of bacteria. But really seeing that effect in the breast milk microbiome for us was really interesting.
What through what mechanism?
Well, it was a great question, James.
Well, it's funny you ask.
Yeah. A lot of people will say that the breast milk microbiome can change its composition depending on the needs of an infant. So that could be one interesting angle. And we've already seen that happen, whereby if a baby is poorly, the microbiome or the breast milk composition itself will change. We've also seen how even the time of day can have an impact on the composition of breast milk. We see an increase in melatonin or a decrease in melatonin depending on where we are in the day. So that's one factor in itself. But another factor that could be is when a baby suckles on the nipple, we actually see an inoculation of bacteria going back into the breast milk microbiome.
Wow, okay.
So it could be somehow that the baby's microbiome is having an impact on the breast milk microbiome. These are just ideas. We don't really know the answer to it, but that was definitely an interesting finding. A lot of the other findings really supported what we knew from literature. So the impact that, for example, a C-section birth can have on both the breast milk microbiome and the infant microbiome. It's really difficult to know whether that's the impact of antibiotics used or whether it's the impact of the C-section itself. It probably is combined factors. So yeah, really interesting things. And I think the more data we collect, the more we understand what those factors are. And it might lead us to be able to have different products that can actually cater to these different factors.
Gosh, yeah, the personalization element, goodness, I mean, that really starts to get interesting. The other question I had was that you mentioned bifidobacteria there as an example of good bacteria. Are there any? Did you find any sort of features of good bacteria versus bad, or like was that easy to say what's good and bad? Like, is that based on previous knowledge? Were you able to test any of that? Like, talk to me about that a little bit.
Definitely. So the first step of what we do when we find these bacteria strains and we isolate them and we bank them, we do something that's called genome annotation of that strain. And what that enables us to do is find out the genetic characteristics of that specific strain. And we can find things like what types of short chain fatty acids can this strain make? Can it survive the journey down to the gut? Can it degrade what we call human milk oligosaccharides that creates really interesting metabolites? But also we can understand the safety of that specific strain, looking at things like virulence factors or antibiotic resistant genes. And so really what we developed, which is quite an important asset that we have in-house, is a bioinformatic pipeline that screens every single strain in our biobank based on these genetic characteristics. And it essentially gives every strain a score. And those that score highly are the strains that we're really interested in. Now, once we've done that in silico using our bioinformatic pipeline, we move into testing them in gut cell models in the lab. So what we can do is we can grow a gut cell monolayer, which is obviously very simplified compared to what's happening in our bodies. And we can do things like inflame that gut monolayer and see, well, if we add our strains onto that gut monolayer, can we recover it? Or we can do things like see whether the gut strains can protect it. So we can incubate the gut monolayer with our strains first and then inflame. And these are all types of experiments that we've been doing where we've seen our Bubibiome strains can maintain the gut integrity of that gut monolayer. We've seen that it can actually reduce the concentration of pro-inflammatory cytokines. And we've even seen that we can increase the expression of tight junction proteins. And so that has been a really important part of the work that we've been doing. And, we might get investors that say, you've been doing this research for 5 years, why on earth have you not got a supplement on the market? And that's the reason why. Because we want to understand the mechanism of action of how our strains actually work. And I believe that that's really how we're going to stand out in the market.
Yeah. So that was actually going to be my next question. The amount of R&D that you've just described to getting something to market, it's perhaps the difference between what we sort of joked about before, the companies that are trying to take the microbiome word from us versus those of us that actually care enough about the research and think about this scientifically and clinically and have that level of analysis and attention to detail and, ethics, dare I say that, ethics and desire to do a good thing, beneficence, non-maleficence, etc. It's an interesting line as a startup, isn't it? Because at the end of the day, you need to make impact. In order to make impact, it needs to be a commercial entity. But in order for it to be a commercial entity, there's a tension, isn't there, between getting something to market that's good enough, that will definitely sell, will have a lovely story attached to it. The comms and marketing job's a relatively straightforward one. This will go big for lots of different reasons. It's that tension versus, I guess, everything that we've talked about in your journey so far about who you are and that attention to detail and that science first. And I guess that's where things like innovate funding can come in for R&D tax credits. And there are all these things that sort of try and ease that tension, right? So my question very, very simply is how on earth do you fund this? How on earth do you fund this to get it to a point where investors even go, oh yeah, right, I see it now? Because, talking to investors about this sort of open-ended blank check of we're going to need to do research until a point, that's that piece of string could be goodness knows how long. I imagine there has to be some mechanism of figuring that stuff out. So how does a science first founder like yourself go about these things in the current funding landscape and try not to use the word Brexit and Horizon or anything like that? Although we're back in the Horizon program, aren't we? So we are back in there, but anyway, you tell me.
So before I talk about how to fund these, I think it's really important that we just talk about how these products are regulated in the first place. So any sort of bacteria supplement for infants, there's two routes that we can go down. You've got your regulated as a food product, or you've got your regulated as a drug, which is what we call a live biotherapeutic product. And what I want to say on that front is if you go down the food supplement route, you can put something on the market without showing any clinical efficacy whatsoever. So you'll show that your strains are safe for consumption, but that's it. And that's why we have so many products in the supplement space that are sold and they don't do anything. Yes, there are some clinical trials, some work, some don't. And I think that's been a really huge problem for both the consumers and for the scientists because it becomes very frustrating. And we are doing things differently because we believe there is scope to really improve what's currently out there if we get the science right. And also, it's a way to really differentiate yourself. So, something that we feel very passionate about is getting the science right, understanding the mechanism of action of the product, conducting clinical trials, and then going to market. And what's that going to help us to do is, hopefully, I say this with a lot of confidence, become the first infant probiotic that has what we call an EU health claim. And at the moment, over 350 companies have applied for an EU health claim, and not a single infant probiotic has been granted one because of this poor design, poor clinical efficacy. And so that's really the approach that we're taking that we feel very passionate about. And then it goes to your next question, how on earth do you fund this? And what's been a really important part of our strategy is Innovate UK grants. And so when we started in 2019, we applied for 6 Innovate UK grants and we didn't get any of them. And these, if anyone is listening that's done these grants, this is a really long process from, Gantt charts, risk registers.
Many listeners will know this. Many listeners will know this.
It's an absolute nightmare. And, 6 applications all failed. And I remember it got to the point we had been doing Booby Biome for 2 years, 3 years. And I had this week where my PhD was due, needed to be submitted, and I'd run out of funding. There was no money left in Booby Biome. We were fundraising. We couldn't get the terms that we wanted, couldn't pay rent. And my co-founder Lydia said, let's just try for one more Innovate UK grant. And of course, me being me, I don't give up. I always want to prove people wrong. I said, go, let's do it. And we won. We won a $500,000 project back in 2021 to really sort of expedite the process of scaling up all the bacteria that we had. And since then, we've been on a winning streak, touch wood, where we've actually won 6 Innovate UK grants. So failed, 6 successful. And we've actually very recently won, which will be announced soon, a 1.6 million Innovate UK grant, which is a collaboration between ourselves and the University of Reading. And what we're going to be doing in this grant is taking the product that we've made, so all of the breast milk microbiome strains, and testing it on an artificial gut. So it's really cool, the type of work that University of Reading are doing. So we can do things like inoculate infant stool or formula-fed infant stool into this artificial gut and understand how our product would interact with that already existing infant gut microbiome. So super exciting times. But of course, we have also had equity investment along the way. So we were backed by Venrex in 2021, who helped us match fund that first Innovate. And they've been absolutely incredible so far. And we're currently doing a seed round now. That's why I have grey hair and lots of wrinkles. So yeah, we've just started fundraising for a seed round. So that's going to be a lot of fun, isn't it, James?
It will. I imagine. Yeah. There are many people that will tell you about how fun that is. But you guys. I mean, this is based in very, very, very good science. It's got a clear commercial model. There are a few different business models that you can and probably will take advantage of. Like, you're picking up Innovate money like there's no tomorrow. Like, this is a very compelling offer. Like, I'm not going to lie. I don't see a world in which you're not oversubscribed, in all honesty. And I know there's plenty of investors that are listening to this podcast that will be, scrambling in the description to find your email address. But yeah, I'm excited. I'm excited for you. For I think you'll have a really interesting investment journey because once this sort of deal hits the market, investors talk as well, and so it won't be long before they'll play hard to get. They always do, and then eventually someone will commit, and then it'll just be a race to see who can go in with you. Yeah, they'll try and get some good terms off you, but it sounds like you know your worth when it comes to terms, which is very nice. So I'm excited for your investment journey. We'll get you back on in a couple of months to talk about it. But one thing I wanted to ask you, so it can often be quite, I think, difficult for people that are very science based to think commercially. I think that's often quite a barrier to scientists becoming founders. In fact, I think it's something that is talked about a lot. I know clinicians are often the same, that we struggle to talk about profit and money and all these different things. But of course, in the world that we live in, it's the way to make impact. That sort of tech transfer journey that you've had there of like commercializing research and getting to a point where you're now thinking about business model and those things, how has that been for you? Because you mentioned at the beginning that you know, lack of role models in science and business. Like you're both in a very, very, very big way here, and often again there can be a tension between the two. So how have you, I guess, managed your way through that to get to a point now where you're Sinead the business person and Sinead the scientist, and you're adopting both of those identities?
Yeah, that's a great question. And I think the first thing that you have to do is know what your weaknesses are. So I recognize that, I'm a good scientist. By now I know how the breast milk microbiome works inside and out. But how to commercialize that was a challenge. And once you recognize what your weaknesses are, you have the opportunity to do two things, right? You have the opportunity to go away and really learn them down to the T, whether that's going on lots of extracurricular modules, or you have the option to really bring in good talent. And I think really it's been a combination of both for me. I've ended up really loving the financial side of the business. So, everything from payroll to VAT returns to R&D tax credits to financial forecasting, it feels strange to say, but I actually love it. And I think that's really my sort of analytical mindset that I've always had, of loving to troubleshoot and doing something and getting it right. It's that sort of feeling of that, getting that high score in the exam. It's really solving something.
You can get 100% when that check box goes to 0 and you're like, oh my goodness, I've completely balanced all the books. The check is 0. That's a wonderful feeling. I do relate.
Yeah. And then when it comes to things like, talking about science to a lay audience is something that I hadn't had much experience in doing either. I was very used to going to conferences sort of across the world, talking about DNA origami to absolute DNA origami specialists. But again, it kind of comes down to my ability to really practice something over and over to get it right, whether that's a pitch deck or whether that's, a presentation that I would give to mothers who might not have the same understanding of the microbiome that we do. But another part of what we've definitely done, which has been really valuable to the company, is bringing in talent. And I've sort of already mentioned Helen O'Neill coming in as a non-executive director already, but having her there who has done what we've done, but is only a year or two ahead, is important. Because sometimes if you get, 5 times founder, 5 times CEO have IPO'd, yes, that is a really valuable role model to have that can help you. But they might not be able to tell you, oh, if you do this and your R&D tax credits, you actually get more back.
Yeah.
Or like, you should speak to this investor because I hear that
this subject line in your emails actually works. Like, yeah.
Exactly.
Yeah, totally.
It's the little things. But another non-executive director that we brought in is a fantastic man called Neil Clark. And he is ex-CEO of Destiny Pharma. And Destiny Pharma are developing live biotherapeutic products for C. difficile. And what he had was a really good understanding of regulation, how to conduct clinical trials, and everything on sort of the clinical side of things that we really didn't know. And so really bringing in those people has been absolutely instrumental. And, now we're reaching the next step of the journey, which is bringing something to market.
Mm-hmm.
And, that's when we will recognize that we haven't done this before. So we'll make sure that we bring people in who, have done marketing or have done BD, and that's something that I'm really excited about.
Awesome. Let's talk about product a minute, and let's do a bit of a deep dive on this. So we're at the point in the story now where we understand the microbiome. We understand at strain level what goes into it. We know how the breast milk microbiome affects the gut microbiome of the infant. We know how their socioeconomic conditions and other factors are now playing in. And you get to a point of wanting to create a product, in this case, a supplement, and I believe some other things too. So how does one then go about? Do you put what someone is deficient in just in a supplement and put that in? Do you have to kill strains and put them in dead? Do you like? I know nothing about creating this sort of stuff, so by all means, educate me.
Yeah, so I'll actually take a little bit of a step back here and talk about we're developing two products. So both are very two different products, but they both do the same thing. And that thing is delivering a breast milk microbiome to every baby. And something that we discovered when we were building our biobank was that we knew from the database that these women would have high abundance of strains of bifidobacterium. But when it came to trying to isolate and grow them, it was impossible. And I remember thinking, oh, the reason that a breast milk microbiome biobank doesn't exist is because it's impossible. we couldn't do it.
Yeah.
And then we started taking a little bit of a closer look. Why can't we grow these? And one of the reasons is these bacteria strains like conditions inside the mammary gland and inside the infant gut. And when you pump milk, you store milk, you let it out for 3 days before you do anything to it, that microbiome is being destroyed. And that's something that we saw in the lab. And we had this idea one day of, playing around in the lab, create a device that can mimic the conditions that we'd see in the gut or within the gland. And we went to our first collection, we put the milk into this device, came back to the lab, and we plated out the bacteria. And that was the first time we saw, the difference between 5 and 50 colonies of bacteria. And it was shocking. It was shocking how for so long we've not really put 2 and 2 together. And that's when we thought to ourselves, if we need to put the breast milk in this device to isolate the bacteria, then babies need to make sure they are putting the milk that they are receiving, if it's being stored, into the same device to make sure that what they receive is that intact breast milk microbiome.
I just want to jump in just to say that I remember when you came on the last podcast, like you explaining this was the bit that just blows my mind that nobody has thought of before. Because when you take a fluid out the body in whatever conditions it was in the body, and then store it in often completely opposite conditions, because you think that's the best thing to do, and it probably is for a few factors, and then expecting it to behave the same, that seems bizarre. To take it out of a human body, put it in a fridge, and then a few days later expect it to be even healthy or the same or whatever, like safe even. Just, it blows my mind that we sit here in, what year are we in, 2024? Like, it blows my mind that is something that we haven't, as scientists who are also people that exist through this process, have even thought about. Like, the best ideas are often like so simple that you think, why has it not been done before? This is one of those for me. Like, it really is.
And what's interesting is that we knew from literature that pumped breast milk, the composition of the microbiome was different to naturally expressed.
Wow.
We also knew that babies who received pumped or stored milk were more likely to be obese, more likely to have respiratory infections.
Interesting.
But nobody had done that piece of research, which is super simple, that joined those two pieces of the puzzle together.
Why do you think that is?
It really comes down to just how it's just completely under-researched and underfunded.
Just, yeah.
It's, for so long, we didn't know this breast milk microbiome existed. We didn't have techniques in the microbiome space that enabled us to actually understand what was in there. And the whole sector is completely dominated by the formula milk industry, which, formula milk is completely necessary for infant nutrition because we know how there's this huge problem of a lack of access to breast milk. But the innovation hasn't been there, or it's been focused on something else. And yeah, I was very happy to make that discovery. And what's really been important for us is making sure that when we bring this product to market, it's universally compatible. So it's an accessory that you can use alongside your Medela, your Tommy Tippy, your LV, or whatever you're using, just to make sure that what you're giving your baby is the best it can possibly be. So that's really sort of, the first product, which was completely accidental. And then the second product is, as I've kind of been alluding to during this whole podcast, is this live microbiome supplement. And when it comes to sort of making that product, I know that you mentioned, do you give it live? Do you give it dead? Kind of what do you do? It's actually quite a simple process, or I say simple, but what we do is we grow these strains in bioreactors. You can either grow them separately or you can grow them in what we call a co-culture. And then you can give those strains to the baby in oil form, droplets, in powdered form. You can mix to formula. There's all sorts of different approaches that you can take, but formulation is very important because you need to make sure that those bacteria, if they are administered live, can actually survive the journey down to the gut. And that can come with a lot of challenges. One thing that we did right at the very start of BB was buy every single infant probiotic that's currently on the market. And we test the viability of the bacterial cells in every single one. And none of them had the CFU dosage that they had on the packet, not a single one. So that goes to show, having the science is really important, getting the formulation right is really important, but it also shows how this is an unregulated space. You can put things on the packet that's just not correct.
And there's a power imbalance, isn't there? Because we talked about the tension between science and commercial companies, and this is one big bit of tension here, isn't there? There's a similar one in the fertility industry as well that I spoke about with Tess, and like where you've got big companies that are making lots of money, that have lots of resource to plug a certain narrative, it's very difficult to actually then develop the science even to because to your point, like the funding's not there, the funding's in other places. If you've got, I was going to name a few companies there, but I won't, but like any of those companies that have the resource to actually create studies that of course will deliver something to their benefit, of course they're going to do it, and of course they're not going to voluntarily act in a way that's going to, I mean, unless they start acquiring, unless they just they do fund this and acquire it very quickly, it's probably quite a nice route to impact actually, because then they actually start redeploying what they should have been deploying in the first place. It seems like an obvious commercial move for them, and perhaps that's where you turn this capitalism to your advantage.
There are some companies that do it. So there are some formula milk companies and some infant probiotic companies that do the research, and you can really see that from the quality of the products that they're developing. But it's just such a shame that there is no real way to distinguish the ones that are doing it from the ones that are not doing it because of going back to this poor regulation piece. So at least we know that we're doing it, and hopefully, things might change when it comes to regulation and all that fun stuff.
Absolutely. So, whereabouts are you guys now? How big's the team? You're approaching the seed round, all that sort of stuff. How long is it until you're reaching market? And tell me about your plans.
So we are obviously 3 female co-founders. I actually haven't had the chance to speak about them yet, but there's the amazing Dr. Lydia Mapstone and Dr. Tara O'Driscoll that I set the company with. We're a really interesting mix of founders, but also scientists, because we all come from completely different scientific disciplines. So Lydia is a microbiologist, so she's really the pro of isolating these different types of bacteria. Then you have Tara, who is a neuroscientist and a bioinformatician. So she's really the one that does all the coding, that builds out these bioinformatic pipelines that allows us to look at huge shotgun metagenomic databases and sort of create data-driven decisions. And then I come at it from the chemistry and the biophysics. So understanding how do these bacteria strains interact with the host or with cells, and how can we formulate this to get it down to the right part of the gut. So really different scientific expertise. But we also gel very well as founders because we all have very different personalities, and we can have really open sort of communications. We can challenge each other, and we definitely can. But we also support each other, which is really nice. And then in terms of the team itself, we have a very scientific team at the moment. So we have a bioinformatician, we have a head of experimental R&D, we have some that do all the bacterial growing, whilst others do the cell work. So really a mix of sort of MSCs and PhD candidates who have come to work with us. And we've been really lucky because all the research that we've done since 2019 has been at Great Ormond Street Institute of Child Health. So really surrounding ourselves with clinical champions. We work very closely with an associate professor called Dr. Mona Badet-Elliott, who is an absolute expert when it comes to everything to do with inflammation and the infant microbiome. And so really sort of strong scientific expertise within the team, and hoping to really sort of double in size in the coming months after the raise, bringing in talent that can help us commercialize and launch to market. And then in terms of where we are, the device, the accessory for breastfeeding mothers, is very close to market. The final batch is currently being manufactured, and we're about to start our beta testing, which is really exciting. Just watching.
We're expecting in December, so if it's ready by then, you can count me as one of the first customers.
Congratulations. I don't think I knew that. So yeah, congrats. Well, I'll make sure to have you guys on the beta testing list if it's
absolutely. Yeah, definitely sign me up. We'll talk about this after.
Okay, let's do it. So that's really exciting, having had an idea sitting around a table and watching that idea turn into, data, a patent, a product, and now beta testing is just wow. So that's going to be coming to market very soon. And as for the live bacterial supplement, I've sort of alluded to this throughout the whole call, where it's a much longer route to market, where we want to have that mechanism of action, have the clinical trials. So really the next step is this big grant that I mentioned with the University of Reading to continue that research and launch in about 2 to 3 years' time.
I rarely get a chance to actually go deep on the science, and it's fascinating. Like, it really is. Like, as I say, I think the microbiome is being thrown around so much, but to actually, and I'm sure listeners will agree, actually, to hear how a company would even go about microbiome research properly has been an education for me. Like, I now understand what the bar is for someone making claims around the microbiome. And of course, I understand that from like a marketing regulation perspective, and pharma and ABPI, and food versus drug. Of course, I know it to some extent, but to actually hear the granular detail of what's required during the R&D to make the claims you want to make, and actually a way of doing it very, very practically that does actually work, that does mean that you can commercialize down the line, and to utilize things like the grant funding that you have. It's actually a wonderful example of how the Innovate UK program does actually facilitate companies that will genuinely change things for so many people. And I think that's the thing, like, the health equity piece here as well. I definitely don't want to leave that out. Like, the way that you're leveling the playing field for infants, people that don't have access to certain health privileges, is wonderful. And also at the other end, the way that you're optimizing health of people as well is wonderful. I think there's so much about this company that, I mean, the talent as well that you're bringing in, like, you are not going to have a problem raising money. Like, I really don't think, like, a lot. I know for few investors that literally just, they only need to see the talent slide, and they're like, they can bring talent in, they don't need to pay them. Like, that's enough for me. So I think you're doing all right there. But listen, like, I do think this is a company that will change the world, and I'm so excited to see what happens with this. But yeah.
But no, thank you for having me. And, it's why we do what we do, especially that point that you just made about the uneven playing field, because we sample milk from so many women and have a complete customer-centric approach to what we're building. We've just seen, the impact of medication, health conditions, difficulty latching, pain, going back to work. I could carry on adoption, surrogacy, lack of education and misinformation. I could really carry on going. And what we like to think about is, it really does require a multifaceted approach to fix this problem. But we know that we are taking a very small but important step to creating a difference and making sure that every baby has at least the opportunity to have a best start of life. And
beautiful.
I can't wait for it to be ready on the market.
Neither can I. Literally, neither can I. I will be a customer. For those people that want to learn more, and for those investors that want to open their checkbooks for you, what's the best way for them to get in touch?
Yeah, so either on our website, you'll find the email address, or on LinkedIn, also on Instagram. So yeah, available on all platforms.
Beautiful. Sinead, it's been an absolute pleasure. Thank you so much.
Brilliant. Thank you for having me, James.